Welcome to the LAOG online podcast. Today we are going to be taking a deep dive into the world of pharmacy.
Okay.
Our source material is a 73-question style interview with Dr. Nicole Winston. She's a clinical pharmacist and educator.
Interesting.
One thing that really caught my eye right away was her favorite part of pharmacy school, studying specifically medicinal chemistry.
Oh, wow. Not what I would have expected.
Right. Makes you realize the kind of dedication and passion you need in this field. I mean, just to become a pharmacist, there are two main paths you can take.
Oh, really? I thought it was pretty straightforward.
Well, you can go straight from high school,
Yeah.
do like a 2-year pre-pharmacy track,
Yeah.
then go on to the PharmD program,
Okay.
which is, another 3 to 4 years?
Yeah.
Or you can get a 4-year degree first
Oh, I see.
and then do the PharmD.
So either way, it's still a pretty big commitment.
Oh, yeah, definitely. And that's just to be a general pharmacist.
Right.
It turns out there are 13 different specializations you can go into.
Wow. 13.
Yeah, like pediatrics oncology, all kinds of things.
Huh. So it's almost like choosing a medical specialty,
Yeah, exactly.
but for medications.
Yeah. So you can imagine with all these pharmacy grads every year, like, what is it, around 12,000?
Around there, yeah.
Those residency programs must be super competitive.
Oh, absolutely. Dr. Winston mentioned there's only about 2,500 spots available each year.
Oh, wow.
Talk about a tough selection process.
Definitely speaks to the high level of expertise needed for those specialized roles. And speaking of expertise, Dr. Winston's path is even more unique.
Oh, how so?
Not only does she have her PharmD, but she also got a doctorate in education, focusing on culturally responsive teaching.
That's impressive. I bet that really informs her work as an educator.
For sure. Now, you had a listener question about how pharmacists interact with doctors.
I did, yeah.
So is it a collaborative relationship, or is it more like, here's your prescription, see you later?
Oh, no. It's way more collaborative than most people think. Pharmacists are drug experts for a reason.
Makes sense.
They work closely with physicians to adjust doses, recommend cost-effective medications, and navigate all those tricky drug interactions.
So they're really like an integral part of the healthcare team.
Absolutely not just someone handing out pills.
That's great to hear. Now, beyond just dispensing meds, Dr. Winston also talked about something I never really considered: tackling drug shortages.
Oh, yeah. That's a big one.
So what does that actually involve?
Well, it happens more often than you think. Certain medications can become scarce for various reasons.
Like what?
Oh, supply chain issues, increased demand, all sorts of things.
Okay.
And when that happens, pharmacists have to find solutions. They might work with other healthcare providers to identify alternative medications.
Okay.
Or even compound custom medications to meet patients' needs.
That sounds pretty challenging.
It can be, especially in rural areas where pharmacists might be the most accessible healthcare provider for miles.
Wow. So their role is even more crucial there.
Definitely. They have to make sure patients get the medications they need, even with those obstacles in the way.
Really highlights that whole drug expert aspect Dr. Winston was talking about.
Absolutely. And her expertise goes beyond just knowing about the drugs themselves.
How so?
Well, she understands how they work within the body and how they can best be used for each individual patient.
That's a really important distinction.
For sure. For example, she shared some insights about commonly prescribed drugs, like hypertension medications, and even the complexities of something like antibiotics.
Oh, yeah. I was surprised to learn that antibiotics are actually incredibly complex. I always thought they were fairly straightforward.
Well, the thing is, there are so many variations in how they work. Some antibiotics target the bacterial cell wall, while others interfere with protein synthesis or other essential processes.
Huh. So they can be super targeted.
Yeah, it's fascinating. Makes you appreciate how much pharmacists need to know to answer patients' questions.
Right. She even got quizzed on antifungal medications by a patient at Walmart.
Oh, wow. Really?
Yeah.
I
Yeah.
guess those interactions can happen anywhere.
Apparently. And it really speaks to the accessibility of pharmacists and the trust people have in their expertise.
Definitely, pharmacists are seen as a reliable source of information about medications.
Even outside of a traditional healthcare setting.
Yeah. Like that Walmart example. They're a trusted resource in the community.
That's really cool.
And it's not just knowing the science. It's about being able to communicate that information clearly.
Oh, yeah, for sure. Dr. Winston talked about how important that is, making sure patients really understand what they're taking.
Right. It's not always easy, though.
I can imagine. Especially with all the complex terminology.
Yeah, she actually compared pharmacology to learning a whole new language.
Wow. That's a great analogy.
It really is. There's so much to it.
So I bet that's a big part of why she's so passionate about teaching.
Definitely. She talked about how rewarding it is, but also the challenges of helping medical students grasp all of this stuff.
Yeah, I mean, think about it. You're explaining these complicated medication instructions to someone who might be anxious or confused.
Right, exactly. It takes a lot of skill and empathy.
For sure. It really shows how important a pharmacist's role is.
Absolutely. And I think her doctorate in education probably plays a big part in that too, especially her focus on culturally responsive teaching.
Oh, yeah, that makes sense. Being able to tailor your communication style to each patient's background.
Exactly. It can make a huge difference in how well they understand and follow their treatment plan.
That's a great point. And speaking of individual patients, Dr. Winston shared some pretty interesting stories about her experiences.
Like what?
Oh, well, she mentioned one patient who actually quizzed her on antifungal medications at Walmart.
Oh, wow. No way.
Yeah, I guess those interactions can happen anywhere.
Apparently so. It's pretty cool, though. It shows how accessible pharmacists are.
And how much people trust their expertise.
Definitely, pharmacists are seen as a reliable source of information.
For sure. Now, beyond her professional life, Dr. Winston also talked about some of her personal interests.
Oh, yeah. Like what?
Well, she's really into spending time with her family, being outdoors, and get this, she plays the trumpet.
Wow. The trumpet. That's awesome.
Right. It seems like she's got a knack for mastering complex systems.
Whether it's music or medications.
Exactly. And speaking of complex systems, we can't forget about the serious side of pharmacy, like the whole issue of medication costs.
Yeah, that's a big one. And something Dr. Winston feels really strongly about.
It's a huge problem affecting so many people. And pharmacists are right there on the front lines.
Definitely. They see it every day. How the cost of medications can be a major barrier.
So what can be done about it?
Well, it's a complex issue that needs to be addressed at a systemic level.
Okay.
But in the meantime, there are things pharmacists can do to help. Like Dr. Winston said, talk to your pharmacist.
Simple as that.
Right. They might know about generic alternatives or other ways to save money.
Makes sense.
Plus, they can help patients navigate insurance formularies, which can be a real headache.
Seriously, so they're not just experts on the drugs, they're experts on the whole system.
Exactly. They're advocates for their patients, making sure they get the medications they need without breaking the bank.
That's a really important point. It's amazing to see just how much pharmacists do. It's so much more than I ever realized.
Right. And as the field keeps changing, those roles are going to become even more important.
Dr. Winston talked a bit about the future of pharmacy, and she's actually pretty optimistic about it.
Yeah, she doesn't seem too worried about the job market or anything.
That's good to hear, especially for anyone thinking about going into pharmacy. Why is she so confident, though?
Well, she thinks there'll be plenty of opportunities as healthcare changes, with things like the aging population and all these new complex drug therapies coming out.
That makes sense. The demand for specialized medication management is only going to increase.
Exactly. And pharmacists are in a perfect position to meet that need.
For sure. We're already seeing more emphasis on personalized medicine and preventative care.
Right. And who better to help with that than someone who knows everything about medications?
Plus, pharmacists can play a huge role in medication adherence, making sure patients understand how to take their meds correctly.
Absolutely. Which can have a big impact on healthcare outcomes and costs.
Definitely.
Yeah.
It really highlights how pharmacists are becoming more than just dispensers.
They're getting more involved in patient education counseling, even direct patient care in some cases.
Which brings us back to something we talked about earlier, that whole idea of pharmacists as advocates.
Right. Whether it's helping with insurance issues or finding affordable alternatives or just explaining things clearly.
They're really there to support their patients.
Exactly.
So as we wrap up this deep dive, I think the biggest takeaway for me is just how vital pharmacists are to the healthcare system.
I agree. They're a wealth of knowledge, and they're always there to help.
So next time you interact with a pharmacist, remember all the expertise they bring to the table. Don't hesitate to ask questions and utilize those resources.
Yeah, they're a valuable part of your healthcare team.
And if you've enjoyed learning about the world of pharmacy, be sure to subscribe to our channel for more deep dives like this one.
We've got plenty more fascinating topics to explore.
Thanks for listening to the LATU Online Podcast.